Hey everybody, welcome back to the channel. So today I am going to show you a quick and easy way to do cross-friction massage for tennis elbow, otherwise known as lateral epicondylitis. So if you've been having elbow pain, you've been diagnosed with tennis elbow, if you have patients that have been diagnosed with tennis elbow, here's how you can show them how they can do their own cross-friction massage, which is going to help aid in the healing of the structures that are damaged. So most of the time, again, it's the ECRB tendon, but that entire common extensor tendon is going to be irritated. The lateral epicondyle is going to be irritated, and so we can help our patients promote circulation. They can work on scar tissue that's been forming, and kind of pulling apart those fibers and kind of breaking down any scar tissue, reorganizing any scar tissue that's formed in there to help them heal. It is a pretty slow process, of course. Like healing from tennis elbow takes usually anywhere from 6 months to, a year and a half, somewhere in that range. So it's very slow. It can be very frustrating, but this is one way that you can really help your patients, or if you've had tennis elbow for a while, this is how you can help yourself. So step one for doing your own cross-friction massage for lateral epicondylitis is obviously going to be able to find the correct structures, right? So you need to be able to find the lateral epicondyle. So an easy way to kind of find it is you can look, we all have this big bony part, the olecranon of the elbow, right behind the elbow, and the lateral epicondyle is just on the outside of that. So it almost, to me, I describe it like a golf ball bone. Like it's kind of a rounded bone. It's definitely prominent. You'll know when you feel it. And if you have tennis elbow, it's going to be pretty tender in that area as well. So that's the lateral epicondyle. And then just down from that is actually going to be where the tendons are starting. So actually kind of drew a little mark. So all of our extensor muscles in the forearm, right, like this whole little wad of muscle, they all connect to the lateral epicondyle via the common extensor tendon, and that kind of runs in almost like a almost like a diagonal direction, right? So I've drawn that kind of with a line so that you can just see exactly where that estimated, is going to kind of run. And what you want to do for a cross-friction massage is actually go perpendicular to the line. So rather than going, kind of along the line, you want to get your fingers down. I usually like to use 2 fingers. You could use 1 finger as well. And you're going to put enough pressure so that you're going to be moving the skin back and forth. So notice that I'm not like dragging my finger up and down. Finger stays in one place. You can use your middle finger as like a brace. Finger stays in one spot, and you're just kind of gliding the tissues, the skin, everything's going to move with your finger. And you're putting a decent amount of pressure into this. I mean, definitely the first minute is probably going to be a little bit tender. You're going to notice that it hurts a little bit. It feels a little bit irritating or tender, but it should start to get numb after about a minute. So kind of hang in there. And you're literally just rocking everything back and forth. Okay, if you do it this way, where you're getting like a lot of skin drag, you might blister your skin or irritate it. So that's why you don't want to do it that way. And essentially what you're doing in that cross-friction massage is you're actually stimulating circulation. So you're stimulating all this good blood flow to come to the area, which will help the tendons to heal. You're also rearranging or organizing scar tissue that's forming in those tendons as healing is taking place. So that's why it helps. Usually you want to continue with this for about 5 minutes. Again, the first minute's going to be probably the worst. And then it should get a little bit better after that because it'll almost kind of go numb. You shouldn't be getting numbness like down the arm or into the hand. So if you notice that, kind of readjust your positioning. Yeah, so it's pretty simple, about 5 minutes at a time. Sometimes it helps if you put a little bit of deep heat into it first. Sometimes that makes it a little more tolerable and you can get a little bit better stretch on the tendon, and kind of help rearrange the scar tissue a little bit easier as well, and makes it a little more comfortable for yourself. So you can definitely try that as well. I hope this has been a helpful video, and Let me know what you think in the comments. Give it a thumbs up if you enjoyed it, and don't forget to subscribe. Thank you for watching.